And then just remember conversations that sound like, oh, well, at my hospital, mince is supposed to include this. Or at my hospital, pureed actually includes this. Those are such ambiguous terms. So if there was one argument, I would say it's all about safety. The use of consistent terminology that's easy to understand helps improve safety.
As clinicians working in dysphagia management, providing guidance on different consistencies to support our patients in their rehabilitation process and daily life is a fundamental aspect of our clinical responsibilities. However, effective communication about these consistencies is a recurring challenge for both patients and clinicians. In previous episodes, you've already heard us talk about IDDSI. We have now had the great pleasure to talk to Peter Lam from the International Dysphagia Diet Standardization Initiative, or short IDDSI. Peter gives a comprehensive overview of IDDSI, what it is, why it is helpful for dysphagia clinicians, and how to start implementing it in clinical practice.
Hi, Peter, and welcome to the Dysphagia Matters podcast. We are very happy to have you as our guest on this episode. Before we start talking about IDDSI, so the International Dysphagia Diet Standardization Initiative, which will be our topic today, would you mind briefly introducing yourself?
Absolutely. Julia and Eula, thank you so much for hosting me on this podcast. My name is Peter Lam. I'm the IDDSI chairperson and chief executive officer. I feel very privileged to have been part of an incredible team that has had a 10-year journey trying to standardize terminology used for dysphagia diets. And we continue our work in supporting implementation processes around the world. I'm a dietitian by profession. I actually have a real day job in addition to my IDDSI duties. I support people with developmental disabilities in my part of the world, and I feel very privileged to be supporting them with their swallowing challenges. So I'm a clinician at heart, and I'm very happy that I continue to be able to have the ability to practice as a clinician, because it helps to ground all of us, I think, when it comes to not only practice, but standards and looking at the world of dysphagia management in a realistic way. Again, thank you for having me here.
Thank you, Peter. It's great to have you here. You're actually the first dietitian on our podcast. So welcome.
Well, I feel extra honored to be the first dietitian on your podcast. Yeah.
Hopefully not the last one. We're working on that. So could you start by explaining what the IDDSI framework is and why this initiative was founded?
Sure. The IDDSI framework in its most simplest form is a framework that helps all of us to be able to use standardized terminology when we are naming liquid thicknesses and naming modified food textures. The framework is accompanied by standardized descriptors that allow us to distinguish between the different thickness levels, the different texture levels. And then in addition to that, there are testing methods that accompany each of these thickness and texture levels that help us to be able to determine what they are easily and practically. In short, that's what the International Dysphagia Diet Standardization Initiative is about. You also asked about how we got started, and it's a very, very long story, but hopefully we can take a long story and make it short. Back in 2009, 2010, I was working on a project within Canada with the Dietitians of Canada, the Association for Dietitians, because what we recognized in Canada was that clinicians all across the country were using different terms different symbols, different schemes to name modified food textures and thickness levels of drinks. And it became incredibly confusing because even though we were trying to standardize how we would describe certain textures and certain drink thicknesses, it wasn't possible to do because everybody was so guarded about, well, this is the way we do things here, and this is the way we do things there. And I'm thinking you probably experienced something very similar in your own practice. Because of that, the Dietitians of Canada supported an initial environmental scan just within Canada alone. What we found was very similar to, I think, other parts of the world that had undergone that same process. There were diverse terms used, diverse schemes, diverse symbols being used to represent different textures and different thicknesses. And we knew already, even just within Canada, that this was going to present very challenging situations as we go forward because there was confusion of food service provisioning level. It was communication challenges between clinicians and patients, patient caregivers. And then worst of all, the misunderstanding of texture terminology actually resulted in a number of deaths due to choking because of misunderstanding about what that term was supposed to mean. And so the work in Canada really expanded then to, before we start doing something that standardizes the terminology in Canada, let's see what the rest of the world is doing. And I had the great fortunes of meeting Dr. Julie Cicero, because at that point, Australia had published their standards. And then I had the privilege of also meeting Caroline Lecco from the United Kingdom, because there were standards published in the UK. And so back in those days, I'm afraid to say, before the wonderful age of online meeting technology like we have now, we actually had to, pick up a telephone and dial the number with our fingers. And I had wonderful conversations with Dr. Julie Cicero and Caroline Lecco, and we were able to convene a teleconference call. Oh my God, I'm aging myself so badly. And I think, in that conversation, we were just simply discussing how we might be able to collaborate. And then fortunately, soon after, Dr. Julie Cicero and I were asked to co-present together at a conference. And we had the opportunity to actually explore the idea of trying to develop standardized terminology, even on a regional level. And I think, it's one of those situations where you dream, and then you dream bigger, and then you dream even bigger. And ultimately, the conversation led to, well, why just do a regional standard? Why couldn't we try to aim for an international standard? So I'll leave it at there, in terms of how the initiative or the idea of the initiative came about.
Thanks for that overview. Sounds like a lot has happened. A lot of work has been done. The next question I'm wondering is more about the organization of the initiative. Who are the people behind IDDSI?
Well, thank you for asking, Hula. The initiative started out with a group of clinicians, researchers, experts in the field of dysphagia management, as well as food science and rheology, came together to, I think, first of all, just address what is in existence. Before we even could get started in thinking about how to standardize, we needed to see what was out there. As you may be aware, in 2023, we had said the International Dysphagia Diet Standardization Initiative celebrated their 10th year. The truth of the matter is the whole idea was born well before that. But in 2013, the first group of experts came together to take a look at what were the practices that were being undertaken in the world around use of thickened drinks, whether it's naturally thick or thickened with thickeners, and, modified food textures. And again, whether it's naturally occurring or altered to have a modified texture. And so we had to consolidate that kind of information. And we were thrilled that when we put out a survey to the international audience, we received, wow, an overwhelming response advising us that they really felt there was a need for standardized terminology. I don't want to go on and name every single person that was involved right from the start, but you can certainly look up all of these wonderful people on our website under the Who We Are tab, IDDSI.org. What I can say to you is the initial group that came together was a very, very diverse group of speech language therapists, dietitians, folks with food service experience, occupational physiotherapists, nurse, physician, as I mentioned, food scientists, rheologists. Dr. Ben Hansen, who's still part of the board now, is in fact a mechanical engineer. And the group practiced in also very diverse and comprehensive areas that address the needs of the newborns, right to those who are aging and in palliative care. So we covered, the whole age spectrum of care. And because of the immense experience of the initial group that came together, I think we've been able to achieve the production of a framework that is really covering the whole care spectrum, covering diverse areas of practice, and available to anybody and everybody.
That is really impressive. Both covering the whole age spectrum, but also having so many different people and so many different professions involved. And I was also impressed when I was looking through the website that I saw that in so many different countries there are groups active. So just as an information for our listeners, because we saw in our last wrap-up of 2023 that we had listeners from over 30 countries listening, and we're very happy about that. So the chances are high that if you want to learn more about IDDSI in your country, that there will be someone be working with it. So what does the standardized framework entail?
So the standardized framework entails 8 levels. And I know this often is confusing to people because, we see the numbers only go up to 7. Okay, but we start from 0, right? And it's a continuum of looking at drinks up to, unmodified drinks, and then ranging all the way up to level 7, regular unmodified food, as well as that sub-level of the easy to chew, which was introduced a little later in the framework. Each of these levels have, as I mentioned before, a testing method that helps to distinguish it from the next level of thickness or the next level of texture. And the names that were carefully chosen for each of these levels were meant to be as simple as possible so that they would be friendly to translation. And Julia, thank you for talking about the number of countries that are involved. And first of all, let me just backtrack and say congratulations for having so many listeners from all over the world. And we are thrilled in IDDSI that we also have that many different countries that are now using, as well as helping to develop local regional practices for IDDSI and implementation of IDDSI. And so that was the reason why it was very important for us to keep the terms simple, keep the testing method simple, keep the descriptor simple. And we're very, very proud to say that, there are well over 20 translations now of the IDDSI framework and more to come, as well as many of the resources. And we couldn't do this without the amazing volunteers from all over the world. And, if I didn't mention it before, IDDSI is a volunteer-driven organization. Sometimes we may give the impression to people looking at our website, looking at what we're doing, thinking that, wow, they must be some kind of wonderful system that's generating a lot of revenue. That's not true whatsoever. We are happy to say that we have wonderful industry sponsors that provide unconditional funding to support our work. but the work that you see, the documents that are available freely to everyone, those are all the efforts of incredible volunteers from all around the world. If you're listening to this podcast and you are one of those wonderful volunteers, give yourself a pat on the back. If you wish to be one of those wonderful volunteers, just please contact us, office@iddsi.org, and just say, hey, I want to help out with IDDSI. We would be happy to invite your support.
We will definitely link this email address in the show notes for the ones interested.
Fantastic. Thank you.
Yeah, and if someone is still thinking about it and maybe isn't sure yet, so why do you think is the IDDSI framework helpful for us as clinicians working in dysphagia management?
So for clinicians, I think the one biggest argument is ease and consistency and safety in communication. I think every one of you can probably think back to using different terminology when you're talking to each other. And I just remember conversations that sound like, oh, well, at my hospital, mince is supposed to include this. Or at my hospital, pureed actually includes this. Or at my hospital, soft includes this. Those are such ambiguous terms. And prior to the testing methods that were developed and standardized, it really created a huge challenge for clinicians to be talking to each other. But then, it went further than that. Clinicians talking to patients, clinicians talking to caregivers, clinicians communicating with food service. So if there was one argument, I would say it's all about safety. The use of consistent terminology that's easy to understand helps improve safety. So please, please, please help to improve safety. If you're still sitting on the fence, get off the fence and come over to the IDDSI side.
And sometimes it might work in one setting, for example, in the one clinic you are working as a clinician, but then your patient hopefully isn't staying in your clinic forever. So they are going to be transferred at some point. So let's say they're in an acute setting and then they're going to an outpatient rehab setting. And then you're going to say, okay, I recommend maybe honey thick liquids and a pureed diet. And then they go out to the rehab setting and they're like, well, honey thick. Let's see what seems like honey thick. So I guess even though it might seem to be working within one clinic, one setting, it probably isn't working once they're out of the setting.
Yes, absolutely. And we have heard now from the community of IDDSI users out there, many have said to us, oh my gosh, why did we wait so long to do this? It's immensely improved the way we are able to talk with each other, have an understanding. It stopped a lot of the fighting that used to happen before where, we would hear of clinicians rejecting certain meal trays because they didn't think this met the standard. Whereas now it's so easy for the kitchen to be able to do the testing, deliver to the patient the correct texture, the correct thickness, because the testing methods are so easy to use.
Well, you have already convinced me for sure, but are there also any barriers or difficulties that clinicians or hospitals face when applying the IDDSI framework?
Oh, for sure. Just want to say to all the listeners out there, we hear your woes. We hear, your comments about the challenges that you are encountering. IDDSI and the implementation of IDDSI takes a community to come together. And often what we're hearing is we'll have pockets of the practice community who are very, very excited about IDDSI, but it's a lot of effort to try to convince other stakeholders that this is something they should adopt. Challenges include things like fear of the unknown. What does it mean to implement IDDSI? And sometimes it's a challenge of time. People just have not taken the time to understand what IDDSI is, and they've made some assumptions. Sometimes it's resources. right? Because it takes time to educate people about IDDSI. It takes time to do the testing. Those become barriers because a lot of times people want immediate results, and that's not what IDDSI is trying to promote. IDDSI is trying to encourage people to make sure that as they undergo this journey of transitioning and implementing IDDSI, we hope that people will go through and carefully do the testing, revise their methods and practices as required, so that ultimately, from a clinical perspective, from a food service provisioning perspective, from a management perspective, all of it meets those descriptors, all of those meet the guidelines, the testing method outcome.
If you want to know more about the IDDSI testing methods, check out the website. There are many resources on the different tests, the necessary material, and also helpful videos. You can find the link to the website in the show notes of this episode.
Also identify then, what are the challenges that still need to be addressed? And that's an ongoing project for us at IDDSI, is to make sure that we hear what are the challenges that are ongoing, and then we try to address them.
Yeah, so I can totally understand that it's probably a lot of work. So just in general, if somebody is having any issues, questions, they can reach out to you, and you are there to support clinicians in their clinical practice, for example.
Yeah, Julia, thank you for bringing that up. We do our best to answer questions if they are not already available as a resource on our website. Again, because we are a volunteer-driven organization and we have a few consultants on hand to support us, we aren't able to always get to very specific questions. Know that if you're thinking about implementing IDDSI, there is an implementation guide that we've created that will help to guide you on a step-by-step basis over a 12-month period, available on our website. So it's iddsi.org/resources. So look in that section. There are audit tools available on our website that could help you determine textures, thicknesses. There are videos available on our YouTube channel, so go to those. We also have past webinars and talks from wonderful presenters that can guide people through the implementation process. Again, that's thanks to the immense contribution of our amazing volunteers out there that have produced all of these different resources. And so don't just look at the resources available through the global website. Each of those countries, under what's happening around the world, also have regional and practice-specific recommendations as well. So please know that if you're looking for something, chances are it's already there. So do some searching before you start creating something new.
Yeah, and some people, or for example, you are quite often at international conferences, so we can actually approach you and ask questions like in person, which is really great as well. And you hand out stuff for free, so I highly recommend going to conferences and meet you.
Thanks, Julia. Yes, please come and visit us at conferences, come visit our booth.
So let's say I work in a hospital and I want to implement the IDDSI framework in this setting. You already said there's all those great resources online. Maybe just to give our listeners a little insight, where would I need to start?
So I think the first thing to start is always don't go at this alone. Make some IDDSI friends, build a team. It's always good to be able to have a team of people that represent diverse stakeholder areas. We have heard stories where it may be just a group of clinicians who are very, very enthusiastic, and they go off and they do all kinds of education. But in the midst of all this effort and work, they may have forgotten to involve the nursing team. They've forgotten to involve the physicians. They've forgotten to involve administration. They've forgotten to involve food service, caregivers. All of those different stakeholders are very, very important in the start of your IDDSI journey, because every one of your IDDSI friends may be able to then go back to their own areas and be able to help bring in more IDDSI friends. And really that, I think, is how we would recommend you begin the journey. And then once that's done, it's always good to just have a good understanding of your current practices. How are things done? Where do things need to be modified in order to become more IDDSI friendly in your practice? Where do we start? And usually most people start with the provision of food and the provision of drink. Okay, how is it made? How is it sourced? How is it served? It's a very friendly environment for multi-professional stakeholder perspectives and contribution, right? Who doesn't want to talk about food? Who doesn't want to talk about drinks? And I think once that foundation is built, it's then easy to be able to go to the next stage of looking at clinical practices that interact with that. Are we using IDDSI texture levels and IDDSI thickness levels when it comes to the assessment process, whether it's non-instrumental or instrumental practices? How is that all documented? Have the information technology people been involved? Are the other healthcare professionals advised and educated about IDDSI, and are they all on board? You asked me a short question. I gave you a very broad and expanded answer, but that's what it involves. It involves a team of people. Please don't try to go at IDDSI implementation on your own. It's very challenging and you will burn out. It's smarter when there's a team working together.
Yeah, it might seem quite easy and straightforward, thinking it's just 8 different levels and we're gonna get there, but I've been there myself. It's not that easy. And I was wondering about, especially like in larger settings, in a big hospital setting, for example, if you have the kitchen, they have so many regulations, restrictions. How can you approach the staff in the kitchen? How can you convince them that we need the IDDSI framework?
First thing would be make friends with the chef, make friends with the director of food service operations, the food service manager. And I think it's important for them to understand why you're bringing forward the subject of IDDSI and why there is, a need to transition from the current system that, people are thinking, well, if it's working, why break it? Why change it? And so it takes some time to have those conversations to allow food service operations to understand practices, what may need to be modified in terms of what they're currently serving, or if there are any additional offerings that might be helpful. We've always said to people, approach all of this from a perspective of promoting health, promoting improved safety. Okay? Nobody can argue against promoting health and safety, right? And then, in the spirit of collaboration, take baby steps together, right? And, so often we hear people say, oh my gosh, it's so overwhelming. Well, what we would suggest is, can we just look at one thing? Okay. And so often in the Western menu, we say, can we just look at the mashed potatoes that's being served? Let's just see if we can aim to have the mashed potatoes in a consistency where it's not overly solidified, it's not overly sticky, that can potentially leave a lot of oral or pharyngeal residue. Okay, can we just do that one thing while we're one more step closer to achieving an IDDSI friendly mashed potato?
Thank you for these helpful recommendations. Let's move on to the evidence. So what is the evidence on the IDDSI framework? What has been the focus of research?
So the research is captured in the publications that are available on our website. And so there are 5 publications that were initiated by IDDSI. They're open access publications, and all of those have gathered and consolidated the evidence that supports the development of IDDSI, and particularly the systematic review that was led by Dr. Katrina Steele and Dr. Julie Chicaro. We would point you to that because that really is the evidence that helps to consolidate and structure the framework the way it was. But the framework was definitely not just created out of thin air. There definitely is evidence behind how the framework was created. And in our framework tab, there's an evidence document as well that you can easily download and take a look at, which supports each of the textural levels.
Okay, I feel like we've hit a hot topic now at this point, because I feel like there are 2 fields in the Research Society. One side is saying that thickened fluids are helpful, are helping. The other field is saying that there is a lack of evidence for positive effects, especially regarding prevention of pneumonia or decreasing mortality. What do you think about this conflict, or what is the standpoint of IDDSI on this?
You asked a really great question. And so I think, first of all, I'll address this by saying IDDSI does not have a position on this because that's not the purpose of IDDSI. IDDSI is, as I explained, a framework for standardized terminology, descriptors, and testing methods. The goal of IDDSI is to promote the use of that standardized terminology, descriptors, and testing methods. We are not in a position to dictate practice or influence practice. We have always been the first people to say the use of any modified drink or modified food is still really based on the discretion of the clinician. And we will continue to say that. But it's wonderful to see that there is this emerging opposed views, because it's often when we have different perspectives that challenge practice that we sort of get the best outcome of this. We just want to be really careful in IDDSI to explain to everyone IDDSI does not favor, nor do we discourage the use of thicken or not thickening. But we certainly hope that as the research progresses, that there would be more evidence that would show us health benefits or health detriments with the use or not use of thickened drinks, whether it's thickener added or naturally thickened just in the production process. We're just hoping that we will see something better than where we're at now with this emerging hot topic debate.
Hopefully. Yes, thank you.
And I think you made a really good point. So we really need to differentiate here. It's not that IDDSI is saying, oh yes, let's thicken all liquids just because we like to use the IDDSI flow test and it's so much fun. The focus is on the standardization. So if you as a clinician think, or as a patient think, it's really helpful and indicated to have a specific consistency, then it's important to have a standardized consistency so that everyone from the whole team in different settings knows exactly which consistency we're talking about here.
Julia, that is a wise remark that you just made. And I fully agree with you. I think, we just have to be careful about how we apply research outcomes and recommendations. I mentioned to you that in my day job, I still see patients And many of my patients have very challenging abilities with the use of thin liquids. And so if I were to say to these individuals, well, that this is what the evidence is showing, and you should no longer be drinking thin liquids, and they continue to cough throughout their meal, and it makes it difficult for them to get sufficient hydration and the nutrition that they need, that would not be very responsible of me as a clinician. But that's not the position of IDDSI. The position of IDDSI is to say, hey, based on you, the clinician's discretion and your clinical judgment, what is most helpful to the person that you are supporting in order to help them achieve optimal nutrition, hydration, best mealtime experience and quality of life.
And I guess it's also important to say what the patient's preferences are.
Absolutely. Absolutely. If you are trying to give me something that I don't like, I'm not going to eat it or I'm not going to drink it, right? So we definitely have to respect the person's preferences and quality of life.
Yes, I think those are great final words. Thank you so much, Peter. We really appreciate it, and we hope you, our listeners, enjoyed this episode as well. And if you would like to get in touch with us and stay informed about upcoming episodes, you can follow us on Instagram at Dysphagia Matters, on Twitter at DysPhagiaPcast, or visit our website dysphagiamatters.org. Thanks so much for listening. Thank you, Peter, for coming on the show, and take care, everyone.